Good afternoon and welcome to Nursing Research 410. It is my pleasure to welcome you to this new course. I am Vicki Bowden. Will be your facilitator for the rest of the 8 weeks. Just to give you a little background about myself, I am the manager of evidence-based practice and quality at Metro Health System in Cleveland, Ohio, and I have been a nurse for almost 30 years, and I'm looking forward to reviewing nursing research in the framework of clinical practice. And as the evidence-based practice specialist manager, I have the interesting view of looking at where research and evidence-based practice intersect. So we're going to start with Chapter 1, and we're going to be moving through the class fairly quickly. I have to say that I'm reading the textbook right along with you since this is my first time facilitating this class. I am not new to nursing education, but I am new to this course. I graduated from Walsh myself in 2016 and have taught for many, many years, both clinically as well as didactically. So I am super excited to getting back to my roots. One of the things that I really embrace is the idea that we're always learning, and in nursing that is more true now than ever. And that nursing research that we look at now is very different than the nursing research that I was learning when I was in nursing school almost 30 years ago. So you'll see that we pepper some questions, kind of knowledge nuggets or knowledge checks along the way throughout this course. And I have to say that, again, I'm reading the textbook right along with you. So it is actually a very well-written textbook. I'm only on Chapter 4, so I'm still learning and reading the chapters. But I feel like it's a very nonsensical clinical approach to nursing research, which has not always been the case. Especially when I was taking nursing research. So question 1 really focuses on research and nursing research. And the question is nursing research the systematic inquiry using disciplined methods to solve problems? So think about that and think about what you've read. The answer is actually false, and it really is technically true. In the vein that all research kind of falls under this major definition that we're looking at a systematic inquiry using disciplined methods. But nursing research specifically looks at the systematic inquiry to develop knowledge about what we find those things that are important to the nursing profession. And when you think about the nursing profession, it is a living, breathing profession. So it is not something that exists in a vacuum or only happens in a laboratory somewhere. We know that our consumers, our patients, are living, breathing humans that have different needs based upon their culture and age and background. So we can't necessarily solve problems in the same way we would if we were dealing with, chemicals in a test tube. So again, nursing research is really that systematic inquiry to develop knowledge about issues of importance. But clinical nursing research is really aimed at guiding nursing practice and improving the health and quality of life of those people that we're caring for, or our clients or patients, depending on which setting you work in. We really function on a consumer-producer continuum when we look at nursing research. The consumers are really those of us that read and evaluate nursing research reports or summary. Those of us that are in clinical practice who are constantly looking at better ways to do things. And the producers of nursing research, who I am, I'm actually a producer of research. It's not my passion as it is some of my colleagues, but it's one of the reasons why we complement each other, because I am a producer of research, meaning that I design and undertake research studies, but it is not my passion and it is not the main part of my job. I leave that to the really, really smart PhD researchers who really live and sleep and eat and breathe nursing research. I participate in nursing research studies, but it is not a main part of my job. So this is just another knowledge nugget. Tell us whether the following statement is true or false. Producers of research design and undertake studies. And as we just talked about, producers of research really are the ones who are have the expertise at designing and undertaking studies and walking nursing research studies from inception to production, evaluation, implementation, evaluation of outcomes, and then publication. So when we look at more of a contemporary emphasis and the kind of future direction for nursing research, we really will have a continued focus on evidence-based practice. And like I said, when I took nursing research when I was in nursing school, it was more focused on producing nursing research to promote the profession. And we know that nursing has come a long way and that we don't necessarily need to prove ourselves the same way we did when I first became a nurse almost 30 years ago. But we still need to focus on nursing research because other research or research bodies are not going to provide us with those nursing-specific evidence-based practice guidelines that we need to provide highest quality, best practice outcomes that our patients are expecting from us. We also know that, as nurses, we need to do more related to quality improvement efforts in healthcare settings, and that's the only way that we are going to improve our patient outcomes. Again, when I first started in the nursing profession, different disciplines really focused on their discipline and worked in silos. And what we've seen over the last 20 years or so is that there is this interprofessional collaboration. When I was first a nurse, the doctor knew everything. The doctor was who we deferred to. But what we've seen, especially in a teaching institution, which is where I function, there is not that you're the doctor, I'm the nurse. It's how do we work best together as a team to provide the highest patient care as well as the highest patient outcomes. We do have an increased emphasis on patient-centeredness, and if you look at what we do and when we talk about evidence-based practice and the kind of like the three arms of it, one of it is very patient-centered, and we can't live in a paternalistic society because we do realize now that the patient has a say in their care. They have just because we tell them to do something doesn't mean that they're necessarily going to do it. We don't live in that paternalistic society that we used to. And patients really are consumers of healthcare and are very educated on what to expect and what they should be doing from their perspective. And then there's an increasing interest in applicability of research. So the clinical significance of research. And we're going to talk about the statistical significance at some point versus the clinical significance of research. And those two things can be very different. When we talk about statistical significance, that's did the data show us something that is significant in relation to a p-value? But clinical significance is super important in that can we take that research that was done and put it into practice? How reasonable is it? How applicable is it to our patient population? And then, how does it take healthcare to the next level? So when we look at the sources of evidence for nursing practice and where we've come versus where we're headed is that the evidence for nursing practice really is recently as 10, 15, 20 years ago, we really relied heavily on two sources for evidence. That was tradition, and you'll still hear nurses out there say, well, we do it that way because we've always done it that way. And that really is, and if you look at some of the groups who are advancing evidence-based practice, that's like sacrilege. We don't want to do things because that's the way we've always done them, or not understanding why we do them the way we do. But looking at it from an evidence-based lens. The other thing that we often looked for when we looked at clinical practice was, what does the authority say? What does a certain panel say? So when we looked at, control of hypertension, not only do we look at research, but we also look at authority or groups of providers who may make recommendations. Authority is fine when it comes from a group of specialists like that. And when I first became an advanced practice nurse, the JNC7 was a group that really looked at hypertension and how we treat hypertension. But at least that group really used research as the basis for their authority or clinical recommendations. When I first became a nurse, the authority was the doctor. Well, we're going to do this because the doctor said this is the plan, versus what we use now, which is the doctor controls that kind of diagnosis and clinical evaluation. But when we look at nursing skills, or those areas of nursing practice that are underneath our influence, really it's nursing research where we should be getting our information from. There is some level of clinical experience and trial and error and intuition that we see as a basis for nursing, but it really should not be what we use for best practice decisions. So I will tell you, I'll give you a perfect example of clinical experience and trial and error. So when I was first working as a PCNA or a nursing assistant, I worked with a nursing assistant who had been a nursing assistant forever. And one of the tips that she told me was, when you have two Chucks pads, that you put the top Chucks pad over the bottom one. Because if you do it the opposite way, any type of liquid's going to go between the two pads versus kind of going downhill without going in between. Hope that makes sense to you. But we're not going to do a research study related to how best to put the Chucks pads on the patient's bed. But she found out that if she put the bottom one over the top one, that the stool and urine went in between. So that's trial and error and intuition. So that was one really smart PCNA who, that stuck with me forever. 30-something years later, I'm still talking about that example. We don't need to do a research study on that. Or when you turn a patient, you want to have certain things, you want to have your things within reach. You don't want to be reaching over the patient. That is based upon some trial and error, intuition. It's also based on body mechanics. So there is that blend of trial and error and clinical experience that really will help you throughout your career. But obviously disciplined research is really where we want to move our practice, especially when it comes to the treatment and prognosis of our patients, as well as signs and symptoms of issues. So paradigm is just a fancy way of the way we look at the world. It's just a general perspective on and how we view the real world, or those certain assumptions about reality. And I will tell you, if you've ever worked with somebody who is very different than you in the way that they look at the world, you will start to understand where this is true. So I'll give you the perfect example. My colleague and I have been, we've worked together in parallel roles for the last 15 or so years. So she was the CNS for medicine, and I was the CNS for surgery. So together we covered med surg. She is now the senior nurse researcher, and I am the evidence-based practice manager. And we again work in parallel views. So when we look at our personalities, I am more of a positivist, and she is more of a constructivist. in the fact that we look at the world in two very different ways. And when we look at that, I am more of the positivist in that I like numbers and data and black and white and a yes or no answer. She has a constructive assumption in the fact that she loves to understand the lived experience or the personality behind decisions. So, for example, if we were to do a research study, I'm going to really be looking at the data. I'm going to be very data driven. I'm going to look at the yes and no questions, or how is it on a Likert scale? And she's going to want to interview the staff in looking at what's their lived experience, what are the barriers. When we look at, so we each have developed, and you will too develop if you ever get involved in nursing research, kind of an area of research that you become involved in, and you kind of just, it snowballs and you get kind of sucked into it, as I would say. Falls is our combined area of interest, and so we've gotten really involved in falls. We've done several research studies regarding falls, and we complement each other in the fact that she is very interested in what are the barriers to putting in falls interventions, and why do certain patients get better interventions than others, and what does the nurse feel about interventions? And I am, very cut and dry. I want to know what are the best evidence, what is the best bundles we have out there, what are the best tools, that are, most predictive, and then once we put those into case, what does that do to our falls number? So you can see our kind of the way that our lens that we look through research in the world is very different. And so when I think about the nature of reality or my worldviews, there are those differences. And the best part is that there are all those kind of people in the world, and they complement each other when it comes to not only nursing research, but nursing practice. So in a positivist paradigm, what occurs? Reality is not fixed. Reality is fixed. It's associated with qualitative research. It's subjective and narrative. And if you paid attention or you read your book, you'll know that B is the correct answer. And really, that is me. I'm that quantitative researcher who wants to know the cut and dry and the data and the number, and that constructed this paradigm. My friend Cheryl is more interested in the qualitative research or subjective kind of narrative materials. And when we talk about qualitative research, there are definitely people who navigate towards it. So this is just a chart that tells you the major differences between the two. And when we talk about quantitative and qualitative research, it'll become very clear that these are two different types of researchers. So the common features of nursing research really look at, we want to answer questions. We want to strive to collect external evidence. We obviously have to function under ethical constraints, and limitations exist. We are, again, caring for human beings, and that has an impact on the kind of research. We want to take research to applying different solutions and really extending information for the sake of knowledge and understanding prognosis and interventions and what are those best therapies, so that we can identify problems and prevent harm to our patients. So that ends chapter 1. In chapter 2, we're going to talk a little bit more about how research informs evidence-based practice and how research helps us understand and provides the best framework for our clinical care.